As was already introduced, Dr. Tedros was invited and would have very much liked to be here. Unfortunately, due to prior commitment, he is unable to do. Therefore, it is my honor and pleasure to speak on his behalf. I bring his greetings, and I also bring you the greetings of Dr. Poonam Khetarpal Singh, the Regional Director for WHO Southeast Asia region. I think the launch of this app would be a very important way to push forward the objectives of the International Union for Patients. So with that, I wish you, Dr. Gupta and colleagues and the app makers all the best.
When patients start reporting directly, that filter is removed, and then the real information on the adverse events and real vigilance happens. And real advantage of vigilance happens when that crude data comes to us. We can actually know that what actually is happening. So people sitting here, this is a request, because most of you may not be directly from or maybe from the healthcare, but the people who are not from the healthcare side, directly involved, you should also help in promoting this initiative from Pharmacopoeia Commission and Pharmacovigilance Program of India. That wherever you are, in your individual capacity, if you are an NGO, you can actually, through your NGO, do some initiatives, improve the awareness among the patients or their family members that this is an important activity, and patients have to become a voice, a strong voice for asking what they need.
This is an area where hospitals have started working. Patient-reported outcome measures and patient-reported experience measures. Now, this is a very new subject which some of our hospitals have started working on it. And this is the excellent information. Once you gather it judicially, the hospital gains, patient gains. So these two initiatives, I'm sure, are going to be part of our union, patient union, in time to come.
First of all, I would like to congratulate you for taking up this issue, which is very relevant today. Instead of being disease-centric, everything should become patient-centric and health-centric. I put it on record that this is a very important initiative, and it will have a long way to go, and it gels with the World Health Organization initiative also. And tomorrow is the World Health Day, and will be definitely associated as a new initiative of India for having a patient-centric healthcare.
It's something which is definitely forward-looking in terms of bringing the patient back into the focus on a more public platform, so that the patient can not only engage with various stakeholders, and here I'm not only talking about the doctors or the pharma companies or the hospitals or the diagnostics, but also more importantly, going forward, the government and the stakeholders in the government who would be equally involved and concerned about patient safety. I think that's an very, very exciting initiative on bringing all these stakeholders on a single platform in a public domain, which will, I think, educate us, a lot of us sitting here, whether it's doctors or hospitals or the pharma companies, on what the patient pain areas are and how can we collectively work towards easing that pain.
The application that's been launched today under the leadership of Dr. Rajendra Gupta, I'm looking at it from the global perspective. This application, in my mind, should be one world, one app. And this app, according to me, looks like one size fit all, because pain of patients across the world is almost the same. A cancer patient here is same as a cancer patient in Africa, the same in the Oceania. So I feel that this application has the ability to address a global challenge,
जितना भी मैंने डॉक्टर से इंटरेक्ट करा था, मुझे मेडिसिन डोज बताया गया था और कुछ खाने का बताया गया था, एंड दैट एजुकेशन डिड नॉट हेल्प मी इन माय डायबिटीज मैनेजमेंट ओवर द years. Only when I got in touch with other people who had lived experience of diabetes, who had that empathy, who could share with me that travel करते टाइम वो अपनी डायबिटीज कैसे मैनेज करते हैं, how do they manage while sleeping, night time hypos, because you get very limited time to spend with the doctors. डॉक्टर्स आपके साथ उतना टाइम स्पेंड कर ही नहीं पाएंगे जो आपको पूरी जानकारी दें. So this app, I think this will allow many people even to just learn from patients interacting with each other on the app, right? वो आपस में बात कर रहे हैं, आपका सवाल भी नहीं है, आप उससे भी काफी कुछ सीख सकते हैं.